Hello everyone, today I'm here in part 3 of my series on learning to regulate the nervous system. So the first section was all about biofeedback, the second video was on heart rate variability, and today we're going to be talking about chronic pain and how your nervous system can get stuck in a feedback loop where you can make your pain or your anxiety worse without realizing it. So today I've invited a guest, Celine Tien. She's the principal investigator on NIH-backed trials studying pain management and opioid use reduction. Celine graduated with distinction from Yale, and she also worked with DreamWorks Animation. She's the founder of Flowly, which is an NIH-backed app that is designed for chronic pain, anxiety, and sleep management. So to boil it all down, she has been studying this stuff for over half a decade, and she knows it forward and backward. So I'm really excited to have her here today to talk with us about chronic pain and the nervous system. Hi everyone! This week we reached 500,000 subscribers, and I can't believe it. A year ago, January, I had around 10,000 subscribers, and I almost quit my YouTube channel because it was a big strain on the family, but now it helps support us, and I hope it helps support you too. So in honor of this milestone, I want to offer all of the courses on my website for 50% off for 1 week only. And I've got some great courses right now. I've got the How to Process Your Emotions course, got Change Your Brain, which is a mental health fundamentals course, and I've got a new course on how to take charge of intrusive thoughts. Now, I worked with Kat Green to make this. She is this incredible psychologist who is just dialed in on it. So this course is short and powerful, and so this week it would be $24. I've also got another new course with Amy Harmon on how to stop hating your body, and normally it's $150, so it's going to be $74 this week. So I just want to say big thank you to all of you subscribers. Keep up the good work, and let's get back to the video. Thank you, Celine, so much for being here with us. I'm really excited to hear more of what you have to say.
Yeah, thanks for having me.
Let's just jump right in. Can we talk a little bit about chronic pain? What is chronic pain? What are some of the diagnoses people might have, and what are some of the contributing factors to it? How's that for a small question to begin with?
That's actually a huge question because chronic pain is incredibly complex. So I'm going to oversimplify it for the sake of the conversation. But the way that we define chronic pain is that it is pain that persists usually past 9 to 12 weeks. And you can think about it in terms of, once you have persisting pain past, a couple months leading to a year or multiple years, that's definitely chronic pain. But the way I think we also think about it is that chronic pain is often thought of as just physical pain. But really, chronic pain is considered a biopsychosocial disease, which means that there is a physical component, a physiological component to pain, but there is also a psychological pain that comes with it. Things like anxiety, like depression, like stress. And then there's also even a social component because most people with chronic pain do experience at some point in their journey feelings of social isolation. So we always want to look at chronic pain very comprehensively because even across, various comorbidities or different types of chronic pain, and there's many, biopsychosocial is a good model of thinking about chronic pain.
Yeah, and for those of my viewers who aren't familiar, the biopsychosocial model is a very common model used to approach a lot of conditions, including depression and anxiety, but also other medical conditions too. Even, I mean, a lot of medical conditions, you consider these various factors. And this is not to say that chronic pain isn't something physical. Like you said, there is a physical aspect of this, but how we think, our psychology around it also impacts our pain levels, right? And our adaptive response to pain.
Yeah. The way that I always also like to put it is that I am very aware that a lot of people in the chronic pain community, especially women and women of color, are constantly gaslit by practitioners and the medical community for what they're experiencing. So I never want to say that chronic pain is not physical and it's not real. It's very, very real. But the way that we frame it is that your mind and your body don't work in silos. So how your body responds to pain is also how your mind responds to pain, and they're very interconnected. And that's why I think it's very valuable to think about your brain, your body as a whole being, because it is so comprehensive, the way that pain affects how you both feel and think and physically manage physical symptoms.
Yeah, and because of that understanding, it gives people a few more options for how to treat it, other than simply physical options, which is I always like giving people options and resources. So that's why I'm really excited about a lot of the work you've been doing. It's fascinating, but it's also evidence-based, and it gives people a lot of options.
Yeah.
So let's talk about, how does the nervous system respond to pain? How does the perception of pain impact the nervous system response?
Yeah, this is a really interesting question. Again, this is actually incredibly complex, but I'm going to simplify for this conversation, which is that a lot of chronic pain becomes persisted in the nervous system, which means that over time, your actual injury or trauma point of where the initial pain was, it leaves that point because it becomes held in your nervous system. So when your nervous system flares up, when your sympathetic tone increases, it starts to really affect how you physically and psychologically feel. And so your nervous system plays an incredibly powerful role in the way that you manage how you physically and mentally feel on a daily basis.
Yeah, yeah. And so you use the term sympathetic, which for the lay person means kind of like that fight, flight, freeze response, right? Correct me if I'm wrong here, but if someone experiences some pain, their nervous system might interpret that as being in danger or needing to get into that activated state. And
Yeah.
then getting into that activated state can sometimes cause like a little bit of a feedback loop. Is that kind of what you're saying?
Yeah, exactly. So here's the way we think about it is, you have your autonomic nervous system, and there's two primary branches. There's your sympathetic and there's your parasympathetic. Your sympathetic, as you said, is your fight or flight mode. And then your parasympathetic is your rest, digest, and recovery mode. Now, what happens with a lot of chronic pain patients is they actually live at a near constant fight or flight mode, which means their sympathetic system is always activated. Because they experience pain, their body experiences stimuli that makes them think that there's a threat. And so they're sweating, or some people live at constant hyperventilation or very high breathing rates. They are not able to calm themselves down. And I mean calming, not just psychologically, but physically calm their nervous system and their body down. And so, what we found that has been incredibly powerful for people with chronic pain is that to teach them how to auto regulate their nervous system. And what that essentially means is we're just teaching you how to turn off that sympathetic system, so fight or flight mode, and then turn on your parasympathetic, which is your rest, digest, and recovery mode.
Yeah, and that's so cool because as you talk about the autonomic nervous system, right? And we divide the nervous system into two parts, right? The central nervous system basically controls the actions we take that are voluntary, like moving my hand like this. And the autonomic nervous system, for my viewers, is just generally things that we don't generally consciously control, like our heart rate, our breathing, our sweating, our skin temperature. And what you're saying is you can help people learn to regulate the autonomic nervous system through a series of skills, a series of education, and that can help soothe that nervous system and soothe that chronic pain response.
Yeah, I really like that you kind of delineated the conscious and the unconscious system, because so much of our body feels unconscious to us in the way we operate. We're not able to consciously say, hey, like, control my beta brain waves, or let's bring down my skin conductance levels. But what we've begun to really realize through, decades of studies and research in the space is that actually there are a few conscious things you can do to affect your unconscious system. And that's incredibly powerful, right? That's almost like unlocking a part of your body that you never thought was possible. And one primary way you can do that, it's incredibly simple, but actually not as easy as it seems, is breathing. So you can control your breathing. And by controlling your breathing, breathing directly affects things like your heart rate variability and your parasympathetic and sympathetic system. So when you learn to breathe at the right rate, you can actually affect how your nervous system responds, and then therefore almost like force your body to relax and recover.
Mm, how interesting. And I really want to learn more about this, and I want to hear more about the actual practical ways that people can learn to kind of modulate their nervous system, tone down their nervous system, or calm themselves down. But before we jump into that, I just want to spend one more minute on this chronic pain kind of feedback loop that we sometimes get stuck on. So so you were talking about how when our body perceives pain, it turns on this sympathetic response, this fight, flight, freeze response. And that fight, flight, freeze response can sometimes make pain worse. Like, I've experienced this. Like, if I'm starting to get a migraine, I'll start to be like, "Oh no, I don't want a migraine. I can't have a migraine." And then I'll start to clench a little bit. My muscles will get a little tighter because I'm in pain, and that'll make me be more likely to get a worse migraine. Is that an example of like how that's like, or do you have another example of how that feedback loop gets kind of stuck with people?
Yeah, it is definitely a negative feedback loop. And I also want to emphasize it's not in your head. It's physiological. And that's really important to understand because a lot of what I'm about to talk about is a what we call a bottom up approach, which is teaching you how to control your body and your physiology first to then affect your mind. Because that feedback that you're talking about, a lot of times people underestimate how much it starts in your body. And one example could be for example, we had a patient, and he was actually shot when he was 16. And then he's had back pain for almost over 50 years. He's on high dosages of daily opioid usage. He's a very, very severe chronic pain patient. And one thing that he always expressed to us was that when he knows that throughout the day he's going to experience flare ups. And when he knows that those flare ups are coming, he gets incredibly anxious. And so that's an example of your sympathetic system flaring up. He gets anxious, he starts short breathing, he gets incredibly angry as well. So there's even an inability to regulate emotions, which is completely makes sense because everything is tied together. And then he's not able to stand up. So then he doesn't go to his doctor's appointments, which negatively impacts the rest of his physiology even more. And then, even just within that day, that makes his pain worse. And then, when his pain gets even worse, he feels like he has to chase away the pain. So then, now he's in a very negative mood and very negative physiological state where he has to look for his medication or he has to do something really quickly to chase that pain and that anxiety. So, and I feel like to some extent we've all experienced that on different ends of the spectrum, but that's a more severe example.
That's such a good example, and I so appreciate you re-emphasizing we're not trying to say, like, pain is in your head or just get over it. We're trying to say, like, these are all connected pieces, and if we can learn to impact one aspect of this, I mean, there's always the physical aspect of managing pain and managing injuries and managing wounds and things like that, but if we can also learn to manage other aspects or influence other aspects, we really can give ourselves more options for treating this, right?
Yeah, yeah, and more integrative options. So, like, having multiple tools in your toolbox is something we always encourage.
Yeah. Yeah, and I think this is so valuable. I mean, if people are experiencing chronic pain, what you're describing is gonna be so valuable for them, but I also see this all the time with panic disorder and with trauma, where using a top-down approach where people are like, "Just calm down, just get over it," it just makes things worse. It can make things, trigger people to be more activated and more distressed. Whereas what you're talking about, like this bottom-up approach, is something that we're using in trauma treatment all the time now, is like this very much like soothe your body, get your brain turned back on, and then you can process through stuff if you can, right?
Yeah, yeah.
Okay, so you were talking about one of the techniques for doing this, or one of the most powerful ways to learn to regulate your nervous system is through breathing. Can you talk a little bit more about that?
Yeah, this is and it's funny because I think recently a lot of people have heard of things like breath work and yoga and all these different ways of breathing that could be potentially beneficial. I think what a lot of people don't realize is that there's something called your resonant frequency breathing rate, which is the breathing rate that is unique to each person, at which they're most able to regulate their nervous system. Actually, what it's directly impacting that breathing rate is something called your heart rate variability. So bear with me here and let me know, Emma, if I need to clarify on any points. But your heart rate variability is the variance in time between heartbeats. And all you really need to know is that it's actually good to have a high heart rate variability. That means your body is able to adapt to threats, but then also be able to calm down when it needs to rest and recover. As you can see by my language there, that seems very tied to the nervous system, and it is. And so a high heart rate variability means you can transition your body from fight or flight to rest and recovery mode. So what we've started to find, and this is based on a lot of past studies and professionals and experts in the space, like Dr. Richard Gevirtz, who's an amazing biofeedback specialist, he really led the way in this resonant frequency breathing rate, because when you're able to identify that breathing rate for you, you can increase your heart rate variability and make your body just calm down and relax. And that's incredibly powerful. So, across all humans, I can say on average that breathing rate is 6 breaths per minute. So that's about 5 seconds in, 5 seconds out. And each person has a slightly different breathing rate. So some people it could be 7 breaths per minute. Some people, 6 or 5 or 4. And there's ways of figuring that out. But once you kind of understand what breathing rate is best for you and unique to your body, it's incredibly powerful in helping you regulate your nervous system.
Yeah, that's incredible. And I have seen Dr. How do you pronounce his name? Dr. Gervertz. Yeah, I've seen some of his papers, some of his studies, and he's got great research showing that learning to increase your heart rate variability has a broad-ranging positive health effects, including things like chronic pain and anxiety and depression, but also asthma and your immune system response and all sorts of other systems going on in your body because it really is regulating your nervous system. Like this stuff is exciting and most people don't know about it, right?
Yeah, it's so powerful, and I think it's one of the things I've been thinking a lot about is we get educated about, like, we go to school, we're taught math and we're taught English and we're taught history, but something so basic like learning how to control your body, now why are we never taught that, right? And so I think that it's incredible, first of all, Emma, that you have this platform and you're sharing this information because it's so valuable, but also everybody should have access to understanding these different things about their body that they can do actionably every day.
Yeah, yeah, I agree. And anyways, I'm excited. I'm excited to be talking about this stuff. I'm sure my audience can tell. But this stuff gets me like really really excited because it's powerful and I've seen it impact people's lives. So, okay. So, let's go to actionable. So you said people can figure out what their resonant frequency is, what their breathing rate should be. How would they figure that out? Other than, try the six breaths per minute, see how that goes, 10 seconds, every 10 seconds, right? But how else, like how could you get more specific with that?
Yeah, well, there's different things you can do. So there are people called biofeedback specialists and clinics that have this, where you can get, basically you go into a clinic, you get hooked up to a bunch of sensors, and then they'll walk you through different breathing exercises, kind of like I'm mentioning. And then you're actually able to see your heart rate and how your body is doing on a computer screen in real time. And then what they're able to do, and what you're able to do as well yourself, is see that at different breathing rates, your heart rate gets to that optimal level, your heart rate variability starts to increase. And then at that point, you can correspond that to what breathing rate you're breathing at and figure out, oh, that's my resonant frequency. The problem is with most biofeedback centers and clinics, it's a little bit hard to access. Not a little, it's very hard to access. That's one of the reasons why we developed Flowly, which is a mobile app that is able to do that calibration for you. So we actually send everybody a Bluetooth heart rate sensor that you simply clip onto your ear, and a virtual reality headset, which makes the therapy more effective. And essentially, we test and calibrate that resonant frequency breathing rate for you within the first 7 sessions. And they're each only about 5 to 7 minutes each.
Yeah, and what results have you seen? Because I know you've been doing a lot of research on the effectiveness of this program. Like, what results are you seeing?
Yeah, we've seen that. Well, first of all, everything we do is based on hundreds of studies already done in the space, a lot of validated therapies that are already used in clinics. We've just changed the form factor to make it more accessible so it can be on your phone. And then we can send you a VR headset that in virtual reality actually makes what we're doing, which is biofeedback, more effective. We've seen in our case studies an average about 46% reduction in pain after each session. And then so far in our early studies, a really significant reduction in opioid usage as well per medication. That's, of course, is completely voluntary weaning. So we never prescribe people to reduce a certain amount of medication. It is simply voluntary in what they feel like they can.
Yeah, and I appreciate you saying that. I mean, obviously, we're not here to give medical advice. Always work with your doctor to determine what's best for you, but understand that learning how to regulate your nervous system can be one tool in your toolbox, right, for managing chronic pain. And I also appreciate that you mentioned, the biofeedback and learning this coherence, learning to develop coherence and to regulate your nervous system. This is something that people have been studying for a long time, but hasn't really reached the threshold of like public knowledge yet. But even more than that, people have been practicing paced breathing for thousands of years. Like this is ancient wisdom that's now being paired up with modern research techniques and being shown to be effective, right?
Oh yeah, I mean this has been done for centuries now. And I come from an Asian household where a lot of my family members are Buddhists and they meditate on a daily basis. And you know, as you may have heard, recent science around meditation is also incredibly powerful. But what we're talking about here is simply, I would say, almost like a shortcut of getting the results from things like meditation, because we're kind of giving you a little quick easy instruction guide on how to force your body into that rest, recovery, and even focus mode. That is what a lot of people do for decades, practicing through acts of like meditation, yoga, etc. And it definitely has been studied and done for decades, but not amongst, I would say, non-clinical or non-research folks. But it's also been used a lot in the athletic community. So a lot of pro athletes and elite athletes, they do these things. They train their heart rate variability. They do very specific pace breathing to optimize their performance.
Like we know meditation and mindfulness is effective and helpful, but in some way, getting this coherence, increasing your heart rate variability and getting to coherence is like people can do that very quickly once they train themselves to do it.
Yeah, exactly. Yeah, you can do it very quickly. And of course, there's a lot of other benefits of practicing meditation and mindfulness over the long term. But what I also like to point out is that biofeedback and this paced breathing and heart rate variability, even virtual reality, what I'm mentioning, what we do at Slowly, it is incredibly helpful for people that do have chronic pain and anxiety or trouble focusing, because I'll just speak for myself here. I know I grew up with a lot of trouble meditating. I would either be very unfocused, or I would start to focus in on what I was thinking, which is a lot of times very negative, or, sometimes I'd even fall asleep during it. And it was just something I really struggled with. And then I think when I first started doing this type of therapy for biofeedback in virtual reality, and this pace breathing guide that I just had to follow, it was incredibly fast for me how quickly I picked it up, because I was able to focus on something external to my body, but that at the same time taught me how to manage my internal body state.
Yeah, that's so cool. It's so cool. And it's something I'm interested in, like still learning more and practicing even more. So, paced breathing, can you go a little bit more in depth into that and give people your best explanation of how to learn this or how to practice this on their own?
The way that I recommend getting into pace breathing is, there's a few things I recommend. One is, if you're starting from the beginning and you don't know your resonant frequency breathing rate yet, then start with 6 breaths per minute. But do it in a comfortable way. So don't go like force yourself from the very get go to breathe in for 5 seconds, out for 5 seconds, if it feels very uncomfortable for you. And you can really assess that for yourself. But one thing that I think has always helped, and a lot of experts in the space taught me, was to think about it in terms of slow breathing and not deep breathing. So a lot of times you get the advice to breathe in deeply. Now, what happens for people, especially if you have chronic pain, you have trauma or anxiety, is that deep breathing and the way of framing that actually can cause hyperventilation, because you're kind of sucking in a lot of air and you're trying to fill your belly or your lungs. The way to think about it is to think slowly. So pace the amount of oxygen and air that you're taking in. And don't think about taking in so much air, but just thinking about taking just enough air so you're reaching 5 seconds, 6 seconds, things like that. So I really love this advice of breathing not deeply, but breathe slowly. The other thing that I also really recommend, and this is also based on powerful, powerful research. Patrick McEwen has a really amazing book on it called The Oxygen Advantage, is to do nasal breathing. Nasal breathing means that you are breathing in through your nose and out through your nose. Because actually, most people are overbreathers. And they're overbreathers because they breathe through their mouth. Your mouth was not designed for breathing, but your nose is. And what happens when you start breathing in and out of your nose is that you can actually start to control your breathing much better as well. For some people, they're going to say, oh, it's very hard for me to breathe in and out of my nose. It's clogged up or things like that. A lot of those reasons are because you've spent a lot of time mouth breathing. So I definitely think it's a practice, work your way to nasal breathing. But once you can nasal breathe, you'll find that it's much easier to really control the amount of air you're inhaling, exhaling because of the way your nose canal is shaped.
Okay, so basically what you're saying is when we do paced breathing, that helps regulate the nervous system, which helps reduce chronic pain. Is that kind of what you're getting at?
Yeah, I mean, I think what it really does is when you increase your heart rate variability, you're putting your body into a parasympathetic state where it's able to relax and digest and recover. And oftentimes that actually comes with an increased feeling of relaxation, but also even an increased feeling of focus as well. And so, a lot of ways I like to think about it is that you've put your body into a really great state of balance, which for a lot of people with chronic pain, that's not something they get to experience on a daily basis because their body constantly has to be in fight or flight mode trying to respond to threats or stimuli like pain.
Is that something you can get better at over time? Like getting into this state of balance?
Oh yeah, the way we think about it, so we actually our app is called Flowly Relaxation Training because it is a type of training. And the more that you work at it, the more you're able to understand how to get your body into that state of balance and into that state of relaxation. It's kind of like going to the gym and you work out so that you gain the muscle. And so you'll get to that point where you feel like, oh, I have a pretty good understanding of the way to breathe and the way to interact with biofeedback and things like that to put myself into a state of relaxation. And then you kind of go back to the gym to maintain that muscle, if that makes sense. So it's definitely something you can get better at, and then you can also maintain.
Huh. So kind of like learning to ride a bicycle, right? Like the initial skill is something you learn once, and then as you practice it, you actually build muscles like the term is vagal tone, right?
Yeah, exactly. Some people even put it in terms of it's almost like working out your vagal tone, your vagus nerve. It's your 10th cranial nerve, and it's actually a collection of nerves in your body that are able to modulate between your physiology and your psychology. And so the more and more you work at it, the more it understands how to modulate for you. The vagus nerve is incredibly fascinating, and people are just starting to understand it. There's a lot of science ongoing, but also a lot of science already done on it. And I think basically what you need to know is something you can do through pace breathing and increasing your HRV. And it's something that you should continue to maintain and do as well because it's a type of training.
It's so cool. It's so powerful. And you developed an app that uses virtual reality to help train people to do this. Can you tell us a little bit more about that?
Yeah, so essentially, we were looking at all this research and studies done for decades, and we were thinking, it's so effective. Why hasn't it taken off? And a lot of it is because it's not accessible. So essentially, we've developed a technology, it's a patented system and method where through a mobile app, you're able to go into these sessions. They're about 10 to 15 minutes each, where we'll collect your real time heart rate and then actually show it to you. And then through breathing guides, through pace breathing, and through virtual reality, we teach you how to control your heart rate variability, so that you send your body into this state of relaxation and focus. And we put it into virtual reality because it can be incredibly helpful for people in terms of focusing and learning how to increase their heart rate variability faster. Because when you put on a VR headset, you're completely immersed. It feels like you're sitting on the beach with the aurora lights above you. It's like relaxing in of itself, but it's also highly immersive. So you actually learn things faster. And then as you get more relaxed, as your HRV goes up, the world in VR starts to change. So more constellations will form in the sky, more flowers will grow. And that's a really beautiful and visceral way to learn how to impact your own body and get that feedback.
Yeah, that's really cool because I mean, traditional biofeedback would have you generally kind of staring at a computer monitor with a graph on it. And I mean, there are other ways for people to do this. If they don't want to use virtual reality, they can practice paced breathing on their own. They can practice biofeedback to a degree on their own or with other systems. This is a really accessible way to do it.
Yeah, it is. And so we do send every member a VR headset and a sensor to get started. Our oldest member is in their 80s and they do it twice a day. So it's actually really easy to use. And we've worked really hard to design it that way. But I always emphasize that it is just one of many options for you, and you can start very simply at home by doing paced breathing or breathing exercises. But for many people, and for even people like myself, that's not enough, or I'm not able to focus doing that. And so this can be a really great option for you to explore.
That's so great. Well, cool. Thank you so much for taking the time today to explain this to us. Thank you for developing all the research you have and the app you have to help people. Really appreciate that.
Thank you, Emma.
Thank you. Thank you.